Hi and welcome to Great Expectations. It's Ask the Doctor today, and our experts in the house are pediatrician Dr. Iqbal Karbani and educational psychologist Sunita Patel. Welcome to both of you. Send in your baby or childcare question right now. While you're busy trying to get a hold of us, let's chat about a common challenge with toddlers. From about the age of 18 months, your sweet little baby may morph into a little horror, throwing tantrums and doing the exact opposite of what you've asked for. The good news, it's normal. The bad news, it may last for years. So let's kick off with understanding tantrums a little better and getting some top tips from our pediatrician and our child behavior expert. I'm going to start with you, Sunita. What exactly is a tantrum?
A tantrum is your child trying to communicate to you and trying to show you this is what I want. It's just that they haven't developed the words yet. They're not that verbal yet. So they're frustrated because they're not able to tell you what they want. And because of their frustration, a tantrum is basically what comes out of it.
That's the only way that they can express themselves, their dissatisfaction.
It's frustration, and I'm not happy, I need to show you.
What age do tantrums usually start?
Around
and when do they end? That's
the
what I
ending
want
part
to know.
is a bit tricky, but it normally starts around the age of 18 months, and it can go on. You see, if a child has developed their verbal skills,
yes,
okay, whenever that may happen, with some it's a bit earlier, with some it's a bit later, but if they're able to communicate to you and tell you this is what I want, it reduces their frustration.
Okay.
So obviously the minute they can start communicating to you and say, okay, this is what I want, they don't have a need to throw a tantrum.
It's very frustrating. Like sometimes I can see my child, you know, I know that there's something he's trying to get at. There's something that he wants, and I don't know what he's saying.
Exactly. And then it sort of escalates into screaming and crying and
the whole story. Iqbal, you're a pediatrician, but you're also a dad. What's your best advice on coping with tantrums?
I think for parents to understand firstly that tantrums are part of normal behavioral patterns.
Okay.
And that, you know, as children get older, the behavioral pattern will change, as Sunita has said. But it's also important that we understand that the child's willpower is developing. He or she is developing a sense of self.
Independence.
Independence.
I'm separate from mommy, I'm separate from daddy.
And a tantrum is in some measure an exertion of that self.
Yeah.
That little person is now declaring his or own willpower to do something in particular. And if that will is not focused or channeled correctly, then tantrums and behavioral patterns will result.
But sometimes it gets extreme. I mean, some kids like bang their heads on the wall or bang their heads on the floor. Some kids bite. Some kids hit. My son hits. Most kids, you know, sometimes it gets quite hectic. How do you cope with those extreme situations?
Look, the extreme situations need careful attention. For example, the head banging. Head banging has been found not to be associated with any major pathology. Usually, it's very rare that a child can really hurt themselves seriously.
Okay.
But I mean, if it's happening repeatedly, then that child should be assessed by a psychologist and seen by the pediatrician.
Some kids can hold their breath. Some kids make themselves vomit.
Yeah.
You know, it gets quite intense.
Breath holding spells can start even before the age of 1. You know, very small babies can have breath holding spells when they're crying and suddenly they hold their breath. But then the body's physiology kicks in. Once they sort of go a little bit bluish on the mouth, then automatically the respiratory center takes over and they start breathing normally. So that is almost like self-limiting. But it's very important also to understand that a tantrum is a two-way dynamic. It's not just a one-way thing. In other words, the child is having a tantrum, but it's influenced by the surrounding dynamic with the parent or the caregiver that's there. And it's that two-way interaction that should be looked at when you're examining the reasons and the management of tantrums.
So Sunita, best advice for a mom who is dealing with like an extreme tantrum, hitting, biting, throwing themselves on the floor, vomiting, fainting, what do you do?
Okay, I think with the hitting and the vomiting and stuff, most children they learn what works, what doesn't work, you know. And the minute, let's say, they say, okay, this works. The minute I start hitting or pretending to throw up, mom gives in.
My child is a hitter.
They actually learn to use that, and then the next time they want something and they can't have it, they don't learn to deal with it. They say, last time I hit and I got
a reaction.
Yes.
So what does mom do? Does mom not react?
I think it depends. You have to first
react
look at
when you're being
safety.
slapped in the face. How do you not react?
It's extremely difficult. But it's important to model behavior to the child. Okay, if the child's throwing a tantrum and you're going to throw a bigger tantrum, what are you teaching that child? you know. And that's why it's important for mom to try and always stay calm. If that's not possible, if mom has reached her limit, put your child in a safe space. If that child is in a safe space, go to another room and just calm yourself first. Because if the child hit you and you're going to react by hitting the child, you're not sending the right message to the child. You're throwing a tantrum yourself. And the child is now confused, like, but you're doing the same thing and you're telling me not to do it.
And you're telling me not to.
Exactly.
So, Iqbal, is it possible that a tantrum could point to a bigger problem, like a medical problem or a psychological problem? And how does mom know the difference between this is my child, you know, being a normal 2-year-old and this is my child who needs some kind of intervention and attention?
You see, behavior is a complex interplay between many factors. The physiological factors in the child itself, in other words, the child's health. For example, let's say a child who's got, a simple example would be severe eczema, or, you know, and the child is scratching the skin all the time.
Yeah.
That child will be very irritable.
Yeah.
The threshold for behavioral change there would be very low. The child can become irritated, throw temper tantrums very easily. The child may not sleep well at night, therefore be restless and tired the next day. So those kind of physiological factors play an important part.
A sick child is going to be a more irritable child.
A sick child is going to be more irritable.
Yeah.
A child with some other disease or iron deficiency, for example, or worms or something like that, may be having behavioral patterns that mimic tantrums.
Okay.
So it's therefore important to have an assessment done to make sure that those kind of causes are excluded.
Okay.
But once that is done, it's important that parents understand that, as what Sunita is basically saying, is that the feedback, positive or negative feedback, influences the development of the tantrum. I'll give you a classic example of swearing. Like a child just starts talking, the minute they say a word that is like a swear word,
everybody reacts.
What does the child see? The child doesn't understand what he's just said, but he knows if I say that word, I get a major reaction. Okay. So therefore I will say that word over and over again. So it's an example of how positive reinforcement influences behavior.
So Sunita, I think for all the moms at home and for myself, we need techniques. What do we do in the moment when this child is going crazy at the mall, at granny's house, at home, at the beach, wherever? What do we do?
I think first of all, for mom to stay calm. If you calm, you're able to handle the situation a lot better, and also your child is picking up a lot of your feelings. You'll be able to settle the tantrum a lot quicker if you stay calm.
Okay, stay calm, number one.
Stay calm.
Yeah.
Also try and if your child is like banging, like you say, banging their head or hitting or
biting,
doing something like that,
yeah.
try and hold them very tight. Touch is very important, so hold them very tight, rock them, sing something soothing to them, just so it calms them down.
So get physical, actually physically stop your child
if you need to. If you need to do that, hold your child, rock them, sing a lullaby to them, something that will calm them down.
That won't aggravate them more?
No, most of them not, because basically they're trying to get a reaction from you. They're trying to get your attention. Okay. And this way they know they're getting it. Trying to teach them at that moment, this is what you did, this was wrong, you're not getting anywhere. That would aggravate it. Don't try and negotiate or try and teach your child what they did wrong while they're throwing a tantrum.
That's not the point. They're not going to hear you then.
No, they're not going to hear you. It's just going to make it worse and worse and prolong the whole tantrum.
Okay.
If you're in a safe space, let's say you're at home, and you can sometimes even let your child just throw the tantrum. You know, you're in a safe space, you're not going to hurt yourself, ignore them. Ignore them to show them that I'm not getting a reaction. This is no fun.
And if more stuff, now that they start throwing things, they start ignore that too?
Well, again, if they're going to be in any danger, hurt themselves or someone else, to maybe take them away from it, distract them, maybe redirect their attention for a while, because trying to teach them again at that moment is not going to help. So get them thinking of something else, redirect their attention, and once they're settled and a lot calmer, then maybe bring the focus back to say, you did this and this is not nice, or what you did was not good. It's not good to throw things, it's not good to hurt people, or whatever message you're trying to send, try and send it once the child is a lot calmer.
And you've got to be consistent about that message. You've got to be consistent every time they react like that.
If they once do something and you give a reaction, they're going to learn that, okay, I'm getting a reaction from mom. Mom gives in when I hit. The next time it's just going to get worse. I'm going to hit 3 or 4 or 5 times. So definitely consistency.
Fantastic advice. Stay with us. After the break, we talk about your tantrums. Yes, I'm talking about you, mommy. But right now, it's time for your Pampers Monday Minute, and today we find out about how the power of loving touch might actually help with those tantrums.
Touch plays an essential sensory role in life. This is vital for bonding. But as time goes by, it becomes more and more difficult to reassure a screaming toddler with touch alone. A toddler's life can be very frustrating because a toddler will always want to do more than his or her skills allow. Encourage him to explore the world around him with all his senses, especially touch. This will allow him to experience positive sensations, which are vital for development and regulation, thus keeping tantrums to a minimum. Another tip for a calmer toddler is massage. Wait for the moments when your toddler is receptive, as it is important for them at this stage that they have choices and some control. Tantrums arise from general frustration, sensory overstimulation, or simply due to sensory discomfort. Allow him the freedom to move, touch, smell, hear, and see things according to his interests and sensory tolerances. Provide sensory experiences for your toddler that will regulate and relax him.
More skincare tips on your next Pampers Monday Minute.
Great advice there, and it's building exactly on what Sunita was just talking about. We're talking about tantrums on our Ask the Doctor today, and you can also add your question or comment to our conversation. You can call us on 011-447-1742 or send in a message. Welcome back. You're with us on Great Expectations, and it's Ask the Doctor Day today. Pediatrician Dr. Iqbal Karbani and educational psychologist Sunita Patel are now joined by gynecologist and obstetrician Dr. V. Naran. You are welcome to give us a call on any child or mom health matter, but we're chatting a little bit more about tantrums first. We've spoken about the tantrum stage in your toddler's development, but did you know that mums can throw tantrums too? It's easy to let our tempers get out of control. We're human after all, but when is it cause for concern? Our docs are here to help. V, welcome to the show.
Thank you, thank you.
It's developmentally normal for toddlers to have tantrums. We've established that, but can parents also be guilty of throwing tantrums too?
Yes, I think anybody can throw tantrums, from toddlers to adults to even the elderly people.
Grannies can throw tantrums.
Absolutely, and it's an outburst of all this energy that you have inside. Maybe negative energy, but it's an outburst. And it's also something that's learned in your life. It depends on your social circumstances, on the amount of responsibility that you're carrying, on the amount of children that you have, you know, and that's how you then release the energy.
It's a coping mechanism.
Yes.
Women in our society are often taught to suppress emotions. You're not allowed anger. You're not allowed to show that kind of a reaction. Does this also contribute to, you know, the way that we deal with anger? If you suppress something for a long time, then it comes out eventually, and it doesn't come out healthily all the time.
Absolutely. I think that suppressing your emotion and suppressing anger is not healthy at all. Okay, but the strength of not getting angry is a strength, not a weakness. So if you, because in the anger you can't reason.
Yeah.
And so you have to separate yourself from that anger and then be reasonable about it and look at situations.
So how do you deal with it then? Because anger is human, it's normal, we all get angry. How do you deal with it without suppressing, but at the same time without going into tantrum mode? What do you do?
I think the basic idea is not to become that anger. You are angry at a situation, but don't become the anger. Now, you first step out of the situation, like Sunita was saying, step out. Second is that you reassess the situation. What exactly are you angry at? Are you angry at that little baby or the child that's not listening? Or are you taking this out on the child because you've had a hard day at job or with the family or with your spouse or you're not getting the support that you want? So reassess the situation. And then I think the third thing is then you react, because then you will react with reason. then you will when you've reassessed and you know exactly what is going on, then you'll react in the correct way.
So it's almost like what you were saying, Sunita, with the child. First, calm yourself down.
Yes.
Evaluate the situation and then see how you're going to react. But it's easier said than done. I mean, if you've just had a baby, or if your period is coming, or if you're, you know, we're dealing with a lot of physiological, hormonal stuff is going on. I mean, that is separate entirely to the emotional journey of dealing with a child on a day-to-day basis. How do you deal with all that at the same time?
Well, there's two kinds of these challenges that you have. Those that are normal, like we're saying that tantrums are basically normal, that you can have. But if you start getting seriously physically disabled with the emotions, if you have insomnia, you're really very irritable, you have low self-esteem,
yes,
you become nervous and you're anxious.
Yes.
Those are signs that there's something else going on here.
Physiological stuff, weight as well, extreme weight loss, extreme weight gain, all that, that's something.
Loss of appetite.
Loss of appetite,
A child that's not growing well and is in your care.
Yeah.
Feeling of wanting to just give up and go and sleep.
Yeah.
That's not a normal child growth in a healthy relationship.
That's when you need to go and see somebody.
There's something going on.
Iqbal, I'm sure you must see a lot of frazzled mums in your consultation rooms. What's your advice to them?
Look, I think they need to be patient with their children, but also patient with themselves. I think this is where a support network is critical. And a support network in the traditional sense of the family may not always be available. So a support network in the case of, for example, friends, you know, other support networks that we have in cities, etc., for parents that are working, are very essential to tap into, especially after life-changing events like having a baby and having, you know, parents that are both working and raising a toddler. Those are not easy challenges.
No.
We need to acknowledge that those are difficult challenges, and people need to be patient with themselves. But saying that, however, the difference between a child and an adult is the measure of self-control. As we get older, we hope we learn to have impulse control.
We hope.
The key word is hope. We hope. But also remember, again, that children model their behavior on what they see in adults. So if a mother or a father is having tantrums, unfortunately the child will mimic those behavioral patterns.
It's a horrible thing, Sunita, to see yourself in your child, especially, well, I mean, and sometimes it's beautiful, but when you see your horrible characteristics, like I see all my drama, I know why this child throws tantrums, because my emotions are like, you gave us some great techniques for what to do with baby. What does mom do when she is on the verge of losing it?
I think I always use a metaphor of a glass, okay? And if you imagine this glass of water to be to the brim, okay, and you add another drop in there, it's going to sort of spill over.
Yes.
You know, and that's exactly what mum is. And mum needs to basically empty her glass, be it gym, be it time for herself, be it whatever mum needs, maybe talking to a friend. If there's a lot of things happening with mum needs to empty her glass, okay? She needs to be able to get rid of all of that so that when the drops of water fall into their glass, it doesn't spill over. Because obviously if you're okay and you're going to be able to handle the situation a lot better, but if you're on the rim waiting to pour over and your child does something, again, like we said, you need to assess the situation. You're not upset your child spilled the cold drink, you're upset now I have to do this again, and I've got so much on my plate, and you know, so mom needs to be able to empty her glass, go to gym, take a little bit time for herself as well. It's very
Integrate
important.
that into your life. That's what the frustration is really coming from.
Yes.
Okay, okay. We're back after the break when we take your questions on any family health concern. From reproductive health to breastfeeding, our doctors are waiting for your call. Our number in Joburg is 011-447-1742, or as always, you can send us a message. Welcome back. Today on Great Expectations, it's Ask the Doctor, and our doctors on call for you are Gynae V. Naren, pediatrician Iqbal Karbani, and educational psychologist Sunita Patel. But before we start with your questions, let's check in with our Preggy Diaries mum and dad, Kim and Quintus, and check and see if they're having any tantrums yet.
Hello, Great Expectations. It's great to see everybody again. As you can see, I am a whopping 30 weeks pregnant. One of the big things, obviously, I started experiencing one of those cramps, those Braxton Hicks contractions.
Yeah.
I think one night I freaked out, Della, because I woke up. I woke up and I was like, Quintus, help me!
Woke me, proceeded to get me out of bed, proceeded to get me to Russia to hospital, because we didn't know what it was, so it was just, eventually we found it was cramps, and she was lying there, I'm dying, is the baby okay, is the baby okay? And then we found it was just some cramps.
I was dying. I didn't say I was dying. My husband has a flair for drama. I did not say I was dying, but I did feel a lot of intense pain. Last week at antenatal class we learned about edema.
Yeah, you can just swell, yeah.
Where you just swell, and it's like a solid swelling.
The other night she woke me.
Oh no, that was my hand. Yeah.
Yeah, in the middle of the night, like
it was it was dead and swollen. Meanwhile, I just knocked my finger in my hand.
Against the headboard.
Yeah.
Failed induction, which is twice.
Look at that, you can even see the water in my foot, you can see it there, look at that.
If you prick her, does she not bleed water?
That was a serious misquote from Shakespeare.
We've had to get the extra bras, well the feeding bras give nice support, and we can use them after the birth as well.
They do, how do you know?
I know this, look at these babies.
Dads, all the husbands out there, do yourselves and your wives a favor. Keep telling her she's the most amazing, beautiful person ever, stretch marks and all, and pretty soon she'll start believing it. But it's been a joyful journey, and thank you guys, Great Expectations, for sharing it with us. We look forward to chatting to you next time.
Thank you for watching.
Cheers. The other day.
They're such a gorgeous couple, and they have a wonderful sense of humor, which is definitely going to take them far as parents. And a special thank you to Stocker, Phillips-Avent, and Tiny Love for the gifts for our Preggy Diaries couple. They'll be getting those very, very soon. I want to start with you, V. You know, Kim spoke about how much love and support and affirmation she's getting from Quintus. He tells her that she's beautiful. He tells her that she still looks amazing. How important is that for mom's self-esteem?
Oh, it is so important. He's such a lovely partner to have. He's supportive, and that's what you need. Somebody that supports you, stands with you, realizes that the pregnancy is temporary. Because, you know, you're going through a lot of physical changes.
Yes.
And you don't feel good about yourself.
No.
You know, and all the swelling
fits,
and the weight.
You're swelling, you look different, your body's just been colonized by something.
Absolutely. And the weight gain, you cannot handle that. And some people do pick up a lot of weight.
Yeah.
So I always say to patients, there's two kinds of problems that you may have. The ones that you must address with your understanding partner, that he must reassure you all the time that the edema is fine, the swelling is fine, the way you look is fine, I'll buy you more clothes if you need to, that's fine. It's the medical problems that you address with me. But the problem comes when partners are not supportive, you know, and then there's a whole lot of emotional issues that women have to go through.
And the emotional issues can actually lead to physical issues ultimately, no?
Yes, definitely. You know, with women doing things that, you know, not eating properly, for example, not having a healthy diet, because she's scared that in the state that she's in, her partner may reject her.
He'll think I'm fat, he won't love me anymore.
Absolutely. And so this is a together thing. You know, and I always say to dads as well, you are so lucky that you're not the one carrying the baby.
Hey.
The only thing you're doing is listening to these complaints. So listen to the complaints.
That's all you have to do.
If her legs are sore, rub the legs for her.
Yeah.
If her back is sore, you need to rub her back for her.
Yeah, you're still wearing the same size jeans. You can rub feet at least.
Yeah. And bend down and turn in your bed. Yeah. So be supportive.
Going back to tantrums now, we've got a caller on the line. I want to say hello to Pat from Soweto. Hello, Pat.
Hi, how are you?
Fine, thank you. How are you, Pat?
I'm good, thanks.
Please share your story, comment, question. What's going on?
Okay, I have a 4-year-old daughter. She will be turning 5 in June.
Okay.
And she constantly throws tantrums. She is my second child, and my first was never like this at all.
Okay.
So she is so stubborn in a way. When I asked that she stops being naughty, she would tell me she won't, and she'd come hit me. I hardly give her a hiding, but she is just, I don't know how to control her. I don't know how to get her understand that, listen, whatever that you're doing is wrong, please stop.
You sound...
What is it that I'm doing wrong as a parent? But I am aware that she knows that I give in every time she cries, because I'm being told that when I'm not around, she behaves well. But when I get home, she becomes something else. So what is it that I'm doing wrong?
You know, I hear you saying, what is it that I'm doing wrong? It sounds like it's incredibly frustrating for you. And that it's also kind of, you've also taken a knock emotionally as well because of all this.
Yes.
Okay, okay. V, let's give her some great advice, guys. V, let's talk about the emotional impact on mommy, you know, because clearly she's feeling like she's not a good mom right now.
Yes. I think it's not her fault that the child is behaving that way. A lot of our children are not, you're not 24 hours with the child. So when you make rules, and when you get home, you're following those rules, but the grannies and the caregivers may not be doing the same thing. So get onto the same step.
I think in this case, remember she said that the child is behaving well when she's not at home. When she gets home, then the child's behavior changes. She's also blaming herself to a large degree.
She is blaming herself.
So it sounds like she's feeling very guilty about not being there in the first place
You
for the child
always
at
feel
home.
guilty. You feel like,
but
what
when
have I
you
done
feel guilty as a
wrong?
parent, you often overcompensate when you come home. So you allow your normal rules to lapse a little bit more. And children by nature take advantage of that. They push it to the limit.
So Iqbal, this is not a child who's got psychological or medical problems.
This child is well behaved in the daytime.
Okay.
So this child is misbehaved when the mom gets home. So mom needs to take a step back and say, fine, if she cries, it's okay. Nothing's going to happen to a child who's crying. She's not going to faint or have a fit or something. It's okay for a child to cry.
It's okay for a child to be upset.
It's okay for a child to be upset. You rather enforce those rules and be consistent about those rules. And put in something like time-out behavior. At the age of 4 or 5, you can start negotiating with the child as well. And you can say, look, this behavior is unacceptable. If you do this, this will happen. And you enforce that.
Sunita, by 4 years old, should tantrums be finished?
Definitely, especially the child. This child is definitely very verbal. The child is definitely understanding what is happening. She's actually manipulating the mum. Okay, and I think again, like Iqbal says, mum needs to put consequences down. It's going to be hard for mum because mum seems to feel very guilty.
She does feel
but mum
very
needs
guilty.
to put that aside, and she needs to say, okay, the next time you're going to do this, this is the consequence, and put the choice in her court. That, okay, if I misbehave, this is going to happen. And she's going to push those boundaries. Initially, she's going to try to see what is mom going to do. What is mom going to do? I'm going to cry louder this time and see if mom's going to, you know, she's going to push those boundaries. But mom needs to be consistent. Mom needs to keep with it, and she'll definitely see an improvement.
Okay. Great advice there for you, Pat. I hope that it helps. We're back after the break with more of your questions for our doctors. Our contact details are on your screen right now, so please get dialing. Welcome back. It's Ask the Doctor today, and your questions are flying in. So let's crack on with your questions. Gynae V, pediatrician Iqbal, and educational psychologist Sunita are with us to give you their expertise. We've got an SMS from one of our mums. It reads, I had my baby 10 days ago, but I still don't have any milk to breastfeed. What should I do? That's from Gail. No milk? 10-day-old baby?
Sure, that's a long time. By now the breast milk should be coming, so she needs to have some help. I think she must increase her fluid intake.
Okay.
Get the baby to suck on the breast, because if the baby doesn't suck on the breast, the milk will not form. So although it feels like milk is not coming out, it actually is.
Okay.
As the baby sucks, the milk is being made.
So does she let baby suck and then
Yes.
she tops up with water?
Absolutely, yes.
Okay.
And there are other medications that you can take to increase breast milk. So just consult her doctor and he'll give a script for
It's
her.
also time probably to see a lactation expert as well.
Absolutely.
Okay. Okay, Iqbal, would you agree?
I agree with that, yeah.
Okay. I've got an email for you, Iqbal. It's from one of our viewers. Her name is Elzette Jafta. She says, my baby's 7 months old and her gums are itching so badly. She now scratches her head almost like she wants to pull her hair out. What can I use for her gums? I've already used T-gel, teething mixture, and Calpol, but nothing works. What must I do? Because she puts anything in her mouth just so that her gums can feel better.
Okay. With teething, they often have referred pain. So what happens is that the pain comes into the ear, So often if you have a toothache, your ear aches as well. That's because the nerves are connected. So when children are teething, they often have pain in the ear. That's why she's rubbing her head and pulling her hair out. She's having pain in the ear. Now the T-gels and the local stuff will only work on the gums. She needs something a bit stronger that will actually work as a pain relief.
Okay.
So she is using paracetamol, which is great. She needs to increase the dose of the paracetamol, and if that's still not helping, she needs to see a doctor so that the ears can be examined to make sure the child doesn't have middle ear infection or something else going on.
But she should increase the paracetamol, the painkiller, under the advice of a doctor.
Yeah, and also just to make sure that the dosing is adequate. Just follow the dosing schedule on the bottle.
Don't exceed it.
Don't exceed it, but look at the dose, because often parents underdose with paracetamol. It's very important to give the correct dose of paracetamol.
Okay. We've got an SMS from one of our moms. It reads, I'm a single mom. I have a 5-year-old who gets violent when he gets angry. It can go on for hours. What is the best way to deal with him? Sometimes I resort to smacking him to make him stop breaking things. Sunita.
Okay, 5 years old again. If the child is able to verbally communicate to you and stuff, again, it's a form of this is what I want and this is how I'm going to get it, okay? I would definitely, with a 5-year-old, set consequences, set boundaries, okay? To say, if you hit again, this is going to be the consequence.
What would some of those consequences look like? If you hit mommy again, if you break that glass again, this is what I'm going to do.
Well, whatever the child enjoys, like I'll take away your PlayStation, or you won't get a new game. You know, whatever, you won't come with me to the mall, or
if a child is this old and they're still hitting and they're still throwing, you know, these massive violent tantrums, could that be a sign that something else is going on, something emotional or psychological is going on with that child?
Definitely as well. But what I would do is I would set the boundaries, and if that doesn't work, then if it continues all the time and it doesn't get better at all, I would definitely consult someone. And also you should need to look at the environment. You need to see, has some change happened recently? Maybe parents separated, or there's been a robbery, or whatever.
Or mommy's working longer hours, or something emotional,
because
some trigger.
Some trigger could also start the tantrums. And
Iqbal, could this be a medical problem?
It could be a medical problem, but the one behavioral problem that needs to be looked at in a 5 or 6-year-old is something like ADHD or attention deficit disorder. Children that have that kind of disorder, or even as part of the spectrum of that disorder, can have often unruly behavior. And that unruly behavior can be very difficult to control.
Where can moms go to get ADHD or ADD diagnosed?
Well, the first point I would advise is to seek a medical opinion. Just to get a basic medical checkup done to make sure there's nothing else going on. You know, I mean, just to give you an example, I've seen a child, for example, recently with constipation. Now, this child was so sort of bloated and having abdominal pain all the time, it was affecting the child's behavior. And the child came to me with a behavior problem. So there's could be lots of other things going on.
Okay. We've got another SMS from one of our lovely viewers. It reads, I'm 28 weeks pregnant and I can't handle this heat. Hey, I know that story. Please, please, please help. What can I do? I can't work. That's from Bertha V.
Well, be encouraged, because I think by the time the baby is born, it's going to be winter.
Yes,
true. And the heat is really difficult, because it's difficult for us not carrying a pregnancy. Poor pregnant women, and especially towards the end of the pregnancy, are swollen, they're hot, their metabolism is really high, and they cannot handle the heat.
I ate ice by the bucket, and people told me that my baby was going to freeze when he came out. He was going to come out blue. What can she do to keep herself cool?
Well, I think wear really nice, light clothing. Hopefully, there's a fan around you, or air conditioning, you know, that can keep you cool. The nights can be difficult because, you know, you can't keep your windows open, you can't, you know, and it does get very difficult. Try and make your environment friendly enough so that you can cool yourself down.
Okay, we've got time for one more SMS. It reads, I hear Sunita's advice. I talk to my son all the time. I try to distract him. I'm consistent, but this is going on for months, maybe even a year, and nothing seems to curb his violent tantrums. That's from Anonymous. What should Anonymous do, Sunita?
I think definitely for her to get, seek some advice from a psychologist, because it could be something more than just boundaries, you know, it could be something more than just manipulation, especially if she's consistent and she's sticking to the boundaries and the angry behavior keeps coming up. It could be something even if the child is going to school or bully or something else, you know, that's definitely bothering this child, because a tantrum again is a form of communication. They're trying to tell you something, they just can't verbalize
They don't know how.
Yes, so definitely get some professional advice there.
Thank you. More of your questions to our baby and mum experts after the break. Welcome back. It's Ask the Doctor today. We still have quite a few baby and mum health questions to answer. So let's continue with our guests, educational psychologist Sunita Patel and gynae Dr. V. Naren. And all the way from the Cape Gate Mediclinic in Cape Town, pediatrician Dr. Iqbal Karbani. But before we chat further, because earlier we had some sound problems, let's take another look at your Pampers Monday Minute.
Touch plays an essential sensory role in life. This is vital for bonding. But as time goes by, it becomes more and more difficult to reassure a screaming toddler with touch alone. A toddler's life can be very frustrating because a toddler will always want to do more than his or her skills allow. Encourage him to explore the world around him with all his senses, especially touch. This will allow him to experience positive sensations, which are vital for development and regulation, thus keeping tantrums to a minimum. Another tip for a calmer toddler is massage. Wait for the moments when your toddler is receptive, as it is important for them at this stage that they have choices and some control. Tantrums arise from general frustration, sensory overstimulation, or simply due to sensory discomfort. Allow him the freedom to move, touch, smell, hear, and see things according to his interests and sensory tolerances. Provide sensory experiences for your toddler that will regulate and relax him.
More skincare tips on your next Pampers Monday Minute.
As always, great advice there. I'm going to roll on with your questions. This one comes from our Facebook mums. It reads, my son is 8 months old, and since his first immunization, he holds his breath every time he cries. What should I do? That's from Buyi. Iqbal.
Breath holding spells, as you said earlier, could be a form of a tantrum early on in life.
Yeah.
They're self-limiting. So in other words, the baby will hold his breath. He may even turn slightly dusky or bluish on the mouth, but then he'll start breathing as the respiration kicks in. So it's not actually a dangerous situation.
He can't
really
pass out from it.
No, he may sort of become a bit drowsy from it, but he will start breathing on his own.
What must mommy do? Is there anything that Buyi can do? Can she hold him?
She can hold him. Look, she should firstly try and avoid the situation where he's going to be, start crying excessively. But secondly, when he does start crying, try and stimulate him. Something just blowing on his face or sprinkling, splashing a bit of water on his face may just sort of snap him out of this.
Okay.
But it is self-limiting.
Okay. We've got another SMS from one of our viewers. It reads, my little boy has severe constipation and lives on laxatives. Tests show there's no apparent problem. What should I do? Should I get a second opinion? Should I keep on with the laxatives? Is this safe? This is from a worried mum. Iqbal.
If it's a laxative that works only in the gut itself, then it's safe. It's not going to be dependence forming. And usually the laxatives used in children are like that. So that should be fine. But the underlying cause should be addressed. We don't know how old this child is, but the child should be on a high fiber diet. It's very, very important. The child should be on a high fiber. And that high fiber diet should become part of the lifestyle of the whole family.
Fruits, vegetables,
absolutely.
Whole grains.
Dried
should be,
fruit, yeah.
Okay.
Avoid all refined foods. Avoid all luxury foods, those kind of things. She should have lots of fruit and vegetables, dried fruit.
Sugar
fiber.
Also is a no-no.
Absolutely. Try and avoid all the natural,
bread?
Brown bread, if at all. And it's very important that even when the stools come back to normal, that the high fiber diet should be continued.
What about enemas? You know, the grannies used to like to give enemas. Is that a good idea?
There is a place for an enema when the child is so blocked up that the stools are very hard and the child cannot pass out that stool without hurting themselves. Then an enema does help, but it's a temporary relief.
Okay.
With constipation, you have to treat the underlying cause, and the take-home message that it takes months and months. Yeah.
Okay, months, wow. Another SMS from one of you guys. My nanny says my kids are well behaved all day long, but the moment I get home, all 3 of them start fighting. I just can't cope. Help me. That's from Greta. Sunita.
If the mum's out the whole day, it's probably the kids trying to just get mum's attention. And obviously, if there's 3 of them, they're all sort of demanding it at the same time.
But it's hard for mum because if she's out all day working and she comes back home, she's got other things that she needs to manage. Now it's bedtime, it's clothes for tomorrow, it's food, how does she integrate the time that she needs to spend with each of those children into her day?
I think try and create like a sort of routine, maybe where she comes in and if the eldest one maybe has homework, try and do the homework while she's doing the cooking or something. So she gives that attention, and maybe when she comes in to give the youngest one 5 or 10 minutes of her time just sitting and playing with them, asking them how was their day.
Is that enough, just 5-10 minutes?
They just want you to know that you're here and you've heard me. You know, they don't need hours and hours of your time. And then obviously if once you work it sort of, like I say, into a timetable, into a routine, maybe bedtime, they all three read together depending on the ages and things. And even on weekends, use any spare time that you have to maximize time with them, to say, okay, I don't have time during the week, but this Saturday is your Saturday and only you and I are going out and we're going to watch a movie, or so that the child feels like, okay, I still got mommy and mommy still listens to me.
Mommy.
Yes. Yes.
We've got time for just 1 or 2 more SMSs. The first one reads, I have a very itchy vagina. I am 35 weeks pregnant. What should I do? Is this a sign of a problem with my baby? That's from Anonymous or V.
Okay, so she needs to have to address this with her doctor.
Yeah.
Because it sounds like she has candida, and thrush is very common in pregnancy.
You're more prone to it actually when you're pregnant.
And it's so easy to treat. So just
Can't she get over-the-counter stuff to treat it, the creams?
She can ask the pharmacist, but it's always better to have first a checkup to make sure it's thrush, and then, you know, get it treated.
1 minute left. I want to squeeze in one more SMS from one of our Facebook moms. It reads, my 2-month-old baby just got circumcised. 3 days later, he's still cranky and he lifts his leg up when he's in pain. Is this serious? That's from Anonymous. Iqbal.
It's not serious. It takes a lot more than 3 days to recover from circumcision. You should just make sure the baby has enough Panado for the next 4 or 5 days. Within a week, he should be back to normal.
Okay, fantastic. Thank you so much, Iqbal. Thank you, Sunita. Thank you, V. Yo, I hope that you, like me, have gotten some valuable advice out of this. More than anything, I hope you feel normal and like there's something that you can do. All of this stuff is a part of parenting. I think we should be paid for actually being parents. There should be a budget that comes from somewhere. It's a daily part of my life. My kid throws tantrums, and then all of you look at me when I'm in Pick and Pay and like, yeah, that's the lady from the TV. But it's fine, because I know I'm just like you. And you can join us tomorrow at 11:30 when we tackle money matters and family budgets. Yuveka will be asking how to raise money-savvy kids. Goodbye, and remember, you're a great mommy.